Hello and welcome to yet another edition of In Focus. So, India has achieved momentous feat in the nationwide COVID-19 vaccination drive. More than 1 crore COVID-19 vaccination doses were administered on Friday, that is yesterday. Big vaccination peak was scaled, over 1 crore jabs in a single day, and indeed it's a mega vaccination landmark. 28 lakh plus jabs were given in the state UP itself and 15 crore plus in the month of August itself, and this is indeed the highest ever vaccination achieved in a single day since the start of the mega vaccination drive in January this year, And in another significant achievement, India's COVID-19 vaccination coverage has crossed 62 crore landmark milestone, and this is the cumulative figure that we are telling you. Record vaccination numbers, a momentous feat, is our topic of In Focus today. Also, 50% of the eligible people have been vaccinated with the first dose. We'll talk about this too. An eminent panel of guests is with us. Dr. N.K. Arora is with us, who heads the working group under the National Technical Advisory Group on Immunization, which is NTAGI. Welcome, sir. Dr. Soumitra Rawat is also with us, who is the Chairman and Head Department of Surgical Gastroenterology and Liver Transplant, Sir Gangaram Hospital, Delhi, and he is part of 12-member National Task Force set up by the Supreme Court to allocate oxygen across India. Welcome, sir. And we also have Dr. Sumit Agarwal, who is the Scientist and Program Officer, Division of Epidemiology and Communicable Diseases, ICMR. Welcome all of you. Welcome Dr. Sumit Agarwal too. First of all, Dr. N.K. Arora, if I can come to you first. Big landmark this, India has achieved 1 crore vaccine doses in a single day. 15 crore jabs, more than in fact 15 crore jabs in the month of August itself. First country in the world to achieve this, over 1 crore vaccine doses in a single day. Your first reaction?
It's a matter of great pride. It re-emphasizes our confidence in our health system, health workers, frontline workers, our scientists, but on top of everything, it is our community, the people who have come forward and shown eagerness to get the vaccine. I must say it gives immense pleasure that if we decide, we are able to achieve those milestones without much ado. And my congratulations to everybody involved, right from the highest political level to the ANM who have accomplished this task.
And also, Dr. Soumitra Rawat, if I can come to you, it involves a lot of planning, a lot of skill, logistics that government has worked upon, and also credit to people like Dr. N.K. Arora also said, credit to people who have been going for the vaccination in big numbers, and congratulations to the government also for making it happen, for making it possible.
I think it's very important in the way when the vaccination drive started in January. Abhishek, you would have seen that, not a lot of people were coming for vaccination. Even in the healthcare worker, there were a lot of hesitancy. So as Dr. Arora has said, that it's really a monumentous task, having a more than 1 crore vaccine in a day, and also more than 4.5 crore of vaccine in a week. So it involves a lot of coordination right from the top level to absolutely at the low level in the village level. That is a primary health care. So there is a coordination and there is a willingness of the common people as well. As you have seen, the people are less hesitant now, and we are just hoping that what we were predicted by end of the year, everybody will be vaccinated. I think if that happens, I think we will be very, very happy as a country.
Absolutely. We'll talk about the vaccine hesitancy also. Has it melted down? We'll talk about that. But again, Dr. Agarwal, your reaction to it. Hard work of health workers and Prime Minister Narendra Modi's or the government's initiative for a free vaccine is in fact shown results.
Yes, definitely. First of all, I would like to congratulate all of the person involved in the supply chain, logistic, and most importantly, those who are producing the vaccine. Because here this time we are not giving a vaccination with the old vaccination.
Yeah.
This you must be aware. This vaccination was got approval in this month, this year in January, and in the record time, like 6 or 8 months, we were able to produce that much of amount. We are giving 1 crore vaccination every day, and if you are aware, I don't know, but the yesterday the stock of vaccine was 4 crore in the morning. So now the vaccine supplies and the vaccine production, the problem has been overcome, and the last part of it is most important part. Those who are getting vaccination, as Dr. Rawat also said, this is the main component. Those who are receiving the vaccine now, hesitancy has reduced and people has shown the trust. That is why the first dose has been completed in 50% of the adult population, those who are eligible.
Right, everyone is talking about the hesitancy. Let's take that question from Dr. N.K. Arora. Dr. Arora, you were talking about the hesitancy. I want to ask you, not only in urban areas it has reduced, I'm talking about the hesitancy, in rural areas too, and for that a lot of credit goes to the government, to the health workers also, and people who have been volunteering and telling the rural area people that why the vaccination is very, very important.
Here. So, as very rightly said by Dr. Rawat, that initially, see, we started with 3,000 immunization centers on 16th of January, and some 10,000 doses were given on day one. And we found that the medical professions who are expected to be leaders, there was a lot of concern, hesitation, and fear of unknown at that time. Everybody was waiting, pehle tum, like. But over the time, people have realized that the vaccines given in this country both are safe and effective. It has made a lot of difference. The second point is that then there was concern after when the second wave came and rural areas were involved, there was concern that rural people don't accept corona as a disease, and therefore vaccination is a far cry. Again, that has been demystified, that no, it is not correct. If you open the COVID dashboard, 2/3 to 3/4 of the vaccine doses given every day during last 1 month are in rural areas. Fourth thing is that this was expected right from the beginning, that there is likely to be vaccine hesitancy, because for the first time we were approaching adults for immunization. There has been no such effort globally for any other country also. So one was not certain, but we had a very rich experience of polio program and measles program. And therefore a proactive approach has been adopted by Ministry of Health and Family Welfare in partnership with UNICEF and media and other agencies to proactively take head on if there are rumors, misinformation, demystify the process, create massive awareness, and debunk wrong information, and involve the key stakeholders, whether it is religious leaders, whether it is political leaders, social leadership. And so I think it was right in the beginning, we took the whole issue and sort of caught the bull by the horn, that we were expecting that there might be issues of vaccine hesitancy. But when we took proactively and took the steps before the things could become bad, and I think today we are in much happier state. Finally, I would also like to compliment all of us. We as Indians, we know globally the vaccine hesitancy is among the lowest. There are repeated several scientific evidences and studies which have shown that vaccine hesitancy is not such a major issue. You today compare it with any of the high income countries, they are having problem because vaccine takers are not there, even when vaccine is available. So I think we have to take this whole issue of vaccine hesitancy in its entirety, rather than in silos, we look at the issue in segments.
Dr. Rawat, is vaccine hesitancy is still an issue? Like Dr. Arora also said, the acceptance that corona is a disease, it took a lot of time, and massive awareness campaign also made a lot of difference. You want to share your experience in regards to to make people understand the impact of corona, especially during the second wave, and also the hesitancy.
I think hesitancy is lot low. As Dr. Arora has also mentioned, that what has happened in due course of time in last 3-4 months, government had worked very hard at a grassroots level. And I was in a meeting of a national task force, and we were informed that there has been more vaccination in the small town than the big cities. So, which is a great sign, because that is where we are worried that the next wave is going to be, if it comes, so that everybody is protected, so that it's not just the major big cities which are getting the vaccination. It is covering each and every village, each and every town, each and every district, each and every state in India. So that is a very good thing, and government has done lot of promotion, lot of talks, lot of benefits of the vaccine. And we also know that to have a fight against corona, we need to have a COVID appropriate behavior, and we need to have a vaccination as and when somebody gets a chance. So these are the things which is really important, because we cannot win it totally. Corona is going to remain with us for a long period of time. WHO has also said that we are in the phase of epidemic. So as long as corona doesn't hurt us, and for corona not to hurt us, we need to have a COVID appropriate behavior so that transmission is not there, and also vaccinate us so that the virus doesn't have people to replicate or cause a mutation, so that we both of us remain comfortable in our own domain.
Saying we need to maintain the COVID appropriate behavior, we need to wear face masks whenever we are going out. We'll talk about that, sir. But Dr. Agarwal, we want to know your reaction. Big landmark has been achieved, big milestone has been achieved, but bigger challenge will be now to maintain it.
Yes, definitely. It is important. And first of all, it is important to understand what is the role of vaccine in COVID. First thing is that the COVID vaccine which we are taking, it's preventing us from the most severe form of the disease and the death of the vaccine. Although it is having protection in transmission, but primary purpose of this vaccine is protecting the deaths and protecting the severity of disease. So this is the most important thing. So transmission definitely will hampered by this, but COVID appropriate behavior we cannot leave, because this is the primary guard which we cannot lower down the primary guard. So whenever or whatever the factors, those who are contributing the transmission, the social distancing and the person-to-person transmission is more important. So that is why wearing the mask, using the hand sanitizer, restricted the movement is more important. As Dr. Rawat has also mentioned, the WHO is now mentioning that the corona is also going to the endemicity. So it means it's going to stay with us for long in a rate which will not hamper our life-to-life activities. So definitely, if you are not vaccinated, if you are incomplete vaccinated, or if you are vaccinated, in the all three conditions, we have to take our protective measures, and we have to adopt it is a part of our life. Now we have to live, we have to understand living with the corona measures, corona protective measures. Like we cannot think after 2 years or 3 years we can leave the mask, we can leave the sanitizers. No, we cannot leave these things. We have to live with all these things.
Right, Dr. Rawat, like Dr. Agarwal is also saying that this will continue. I mean, this is our new normal. We have been saying this for the last 1.5 years, that using sanitizers, maintaining COVID appropriate behavior, maintaining social distancing. But practically, I mean, we know how Indian society works. Marriages will happen where we have a gathering of 500, 600 people. People will go in the mall. People will I mean, go in big numbers when we celebrate festivals. Mega awareness campaign should also be run, even if we get vaccinated, like our realistic target. If we achieve that by the end of December, but then this is very, very important. The next step should be to tell people and make people aware, especially in rural areas, that this has to be maintained. COVID appropriate behavior has to be maintained.
I think it's absolutely right. We cannot get rid of the virus. I think our aim is, as long as it doesn't hurt us. And as government has also come out with the 5-fold strategy, that is test, track, treat, follow COVID appropriate behavior, and get vaccinated. So this is what we need to do. And what we also need to do is avoid touching eyes, nose, mouth, avoid large gathering, whether it's political, whether it's social, whether it's religious. So, this is what, it's like a common sense. This is what we need to do. As soon as we are stepping out of the home, we need to wear the mask. Don't touch anything. And, if you are touching anything, wash your hands, sanitize. Don't go to large gathering. And, I also keep on telling the government as well, for the social gathering or the wedding, I think we need to set up a rule that, there shouldn't be more than a particular number of people in a particular gathering, and all of them need to have a COVID appropriate behavior. I think that is what we need to do in next 6 months to 1 year, till the time virus settles down.
Dr. Arora, is this a new normal? I mean, even if we, like I was asking Mr. Rawat also, even if we get fully vaccinated, maintaining the COVID appropriate behavior is very, very important. Mega campaigns have to be run after we get fully vaccinated. We need to tell people, we need to make them aware that this has to be followed for the next, like Dr. Rawat is saying, for the next at least 6 months.
So I will take the example of Southeast Asia, where the impact of corona has been quite less or minimal. And one of the major reasons is that as a cultural practice, mask is used. It has several additional benefits. We know from clinicians during last 1.5 years, respiratory infections have gone down because of the use of masks. And again, recently now for last 4 weeks to 3 weeks in Delhi and surrounding area, we are getting again a flu kind of an epidemic, because many of us have just given up masks because we are immunizing and we think there are no cases around. So I think this has to become a part of not new norm, but part of the culture and the living of all of us. 1. 2 is social distance. I think one of the finest thing we have in our living style is namaskar, so that we don't touch each other's hands. And sanitation and hygiene is. So I think we have to move into that framework where social distancing, masking and hygiene becomes integral. It may be considered kind of something very bad if any breach occurs, because this is not the first pandemic we will be looking in our lifetimes. There will be many more. And as I said, there are spin-off effects. Tuberculosis will benefit, measles will benefit, the other pneumonia or respiratory tract infections will benefit. And therefore, there is a very strong justification that we must follow this. The point of social distance, I would like to say that दो गज की दूरी is not between human beings. I think social distancing has to be understood in the larger context, where social gatherings, crowding is something which is harmful. And I think that is something which we have seen repeatedly. Political rallies, religious gatherings, religious, a kind of a relief there, not following the containment policies, whether it was Uttar Pradesh or east part of the India, Bengal, or now Kerala, we are seeing. We need to be extremely a kind of a learning from our experience that whenever there is a we are letting our guards down, it comes and hits back. Savdhani hati, durghatana ghati. I think we have to follow this. Otherwise, we'll keep on having these ups and downs, and very valuable lives and our dear and near ones, we'll be losing them.
Absolutely. We need to see a bigger picture here. People's behavior needs to be changed here. But Dr. Rawat, you talked about mutations. We have had Delta, Delta plus, we don't know what's next. But if virus continues to mutate, then do you think we'll have booster shots or the tweak, slight tweak in the vaccine too that covers the mutant?
I think it's a very important question. I think what has come is regarding a mutation. First of all, it was a alpha variant in UK. Then it was beta in Brazil, and then it was gamma in South Africa, and then we had delta. And why delta was so problematic? Because there was an increased transmission, there was an increased virulence, and there was a change in clinical disease presentation as well. So what happens that if there is a further mutation, and then we will need to find out whether the mutation is it is a mutation of interest or it is a mutation of concern. If it is a mutation of concern, then we need to be wary about it. I was in England for 17 years. Every year I will have a flu vaccine jab. So in flu vaccine jab, they will take care of whatsoever the mutation of the last 1 year as well. Regarding the corona, we really don't know. There is a lot of studies going on regarding the mutation. There is a lot of studies going about the booster dose as well. America has started giving, they will start giving the booster dose from 20th of September.
Yeah.
And ICMR has come out with their recommendation as well. They are going to do the study in India regarding the booster dose. There has been a study which has come out from Nottingham recently that if you have a booster dose, then obviously what happened that, you know, your immune response becomes a bit more better. But then we need to see what is the right time of a booster dose. America is saying the right time is 8 months after you had the first vaccine. Okay. So that is what they are saying. I think it is a very hot debated topic. We will know for sure in next few months what is going to happen. But as we have said that if we vaccinate ourselves, if we have a COVID appropriate behavior, we will live safely with the virus. There has been so many viruses around. I think we need to live safely. And as it happened with Spanish flu, I think we need to look into the history. Spanish flu started in 1918.
Yeah.
It carried on for 2.5 years. And after 3 years, nobody, was bothered about the Spanish flu. So at the moment, we are into 1.5 years of corona. I think it will be there for next 1.5 years. And then we will be living comfortably with the virus.
Right. Dr. Arora, gap in the vaccine doses is also a very, very interesting topic. I mean, there are talks now, you can tell this better. The gap between the Covishield vaccine, 2 doses will be reduced now or not? That's the biggest question. The gap between 2 doses of Covaxin is 28 days. Sputnik is different, 21 days. Moderna will come, Johnson & Johnson will come. You can explain it better, the significance of this gap and how long should the gap be, and is the is a longer gap is better for the people who are getting vaccinated?
So thank you very much for raising. I was waiting for this question to be asked. So today, Covaxin is 4 weeks. There is Sputnik is 3 to 6 weeks, and Covaxin is 4 to 6 weeks. The new vaccine Zycov-D is also 4 weeks per between 2 doses, and that is how it will be. See 4 to 6 weeks between doses, and 3 doses have to be given. And coming to Covishield, it is, we started with 4 weeks, but as the new evidence emerged, it was from Covishield. For vectored vaccine, it has been found that if the interval is increased, the antibody response is better. So we took it to 12 to 16 weeks in the second week of May. And but simultaneously, we are reviewing all the available publications in this, that what is the influence of interval on the vaccine effectiveness, and also if somebody receives only single vaccine, and we know a sizable proportion of Indians have got only single vaccine, what is the impact or what is the vaccine effectiveness in that? So, and now a vaccine tracking platform is under kind of construction, and which will be made public very soon.
Okay.
And all these data are being reviewed very regularly. So at the moment, there is no proposal under consideration for changing any of the vaccine intervals. Vaccines, whatever vaccines are given, seem to be working very well for 2 things, as Sumit said, for preventing severe disease and preventing hospitalization and death. And these are the actual thing across the world. Whatever vaccines are available, these are the 2 things are stable, that over 95% protection occurs for these 2, severe disease and death. There may be difference in effectiveness of symptomatic disease from 60% to 90%, but from a public health point of view, that is less important. The most important thing from a public health and individual level also, that I should not be having a disease which requires hospitalization, oxygen therapy, ventilation, or there is a fatality associated with the illness. And all of our vaccines currently available in the country are safe and effective, more than 95% to protect us from severe disease and death.
Right, big point that you have made, that you can go for any of the vaccines, be it Covishield, Covaxin, Sputnik, or any of the vaccines that you get. It's very, very important to get vaccinated, and as soon as possible. And we urge from DD India, through DD India, that if you are eligible for the vaccination, go and get yourself vaccinated. But again, Dr. Agarwal, you also must be getting a lot of questions related to the gap of the COVID vaccines, whether they can, whether they go for Covishield, Covaxin, Sputnik. Moderna will also come, Johnson & Johnson will also be rolled out. What answer do you give them? And whenever, in fact, we also go, they ask them that why a difference 14 to 16 weeks in Covishield, why 28 days in Covaxin and 21 days in Sputnik?
So yes, that is very important to understand why there is difference. As Dr. Arora sir explained it very well way, but I will just add one or two more things. Like the type of vaccine which are available is different kinds of vaccine. Like if you talk about Covaxin, it is a dead virus vaccine, or you can say it's an inactivated virus vaccine. So like that, Moderna, Pfizer is mRNA vaccine, and different vaccine has a different mechanism. And Covishield, which are using, is a chimpanzee vaccine which has been modified and developed with the virus. So for the 1 or 2 antigens. So mechanism of these vaccines are different, development process are different. That is why the efficacy, when it's come to the body level antibody generation and the other factors generation, it will show there is a difference. So body response in that manner. So as sir explained, some vaccines take a lesser time to get a booster dose and show a better efficacy, and some vaccines may take a higher time. But it is a fact, whenever you are giving a second dose, it will act as a booster dose, and that the appropriate time will be defined only by the studies, clinical trial studies, which also takes time. So we cannot predict by saying how much will be the appropriate time. For that, we have to conduct the study. As sir said, we are already conducting a ICMR through ICMR in booster phase studies, and that will tell us what is the appropriate time and gap for the vaccine. Now, in future, maybe we can have Johnson and Johnson, which will have single dose vaccine, and might be there will be no need of booster dose in month. Maybe year vaccination, as Dr. Rawat said, there is a yearly vaccination is needed in few diseases. So that will be taken into consideration. Also, if you want to talk about the mutation is inevitable. We cannot escape from that. And every virus has a character, and this is RNA virus, which will definitely have the mutation. So mutation is inevitable. So that is going to change the genomic structure of virus. And maybe if structure changes large, then there might be needed of changing in the vaccination development process or the virus which we are using for the development of vaccine.
Right,
Yes.
Dr. Agarwal, we'll have a detailed discussion on mutations also, but we'll have to take a very short break here. COVID vaccinations are being produced in big numbers, but are we seeing India moving freely without the mask? We'll talk about that also and mutations also, but after a very short break.
With the world's largest COVID vaccination drive, India is leading the way. As the vaccine reaches every corner of the nation, do not forget the mantra, Dawai bhi, Kadai bhi. Let's continue our fight against COVID-19. Vaccination along with social distancing, sanitization and masks.
Mask up, India!
Put your mask on and cover your nose and be safe.
Mask Up India.
Right, welcome back after a short break. Big milestone. India has achieved 1 crore vaccine doses in a single day. Over 1 crore, I should say, 62 crore figure that we have surpassed, cumulative figure that I am talking about, and more than 50% of the people, eligible people, have been vaccinated with at least the first dose. We are having a discussion on that. Dr. N.K. Arora is with us, Dr. Soumitra Rawat and Dr. Sumit Agarwal, he is also with us. We were talking about the mutations when we had gone for a break. Dr. Rawat, according to a research paper, every time mutations change, new variant of the virus emerges. It's just that we need to get vaccinated if we are eligible and follow the COVID appropriate behavior. This is very important.
Yeah, the mutation, obviously, virus mutate because they want to survive. So there are two things, which virus does. One is to replicate and second is to mutate. And as you've seen that, there has been a lot of mutation, alpha, beta, gamma, epsilon, delta, delta plus. So, there has been a lot of mutation. What mutation does for virus to survive, otherwise virus won't survive, won't be able to survive. There has been a double mutation, there has been a triple mutation. What we need to be sure about, whether the mutation is of interest or concern.
Okay.
So what happens if it is of the interest, then it doesn't worry us. It becomes a matter of concern when the transmission increases, virulence increases, there is a change in clinical presentation, and also the effectiveness also of various antibodies treatment, they also changes quite a lot. And also the vaccine efficacy also decreases slightly. So these are the things which makes the changes. So like when in Delta variant, there was a strong binding in the receptor of the lung cell, as a result of which we saw a lot of morbidity, and there was quite a lot of virulence, and quite a few people, they were getting admitted in the hospital, and which Dr. Sumit has very nicely described, and Dr. Arora as well. If you are vaccinated, then what happened? You will have a disease, but you will avoid having a very severe disease, and the mortality rate is very, very low.
Right. Dr. Agarwal, virus mutations can't be stopped. You also said this, but how safe after the vaccine we are? We need to understand this. And the efficacy of the vaccine against these mutations, we want to know.
Yes, actually, it is important to know at this point. Now we are having a Delta and Delta plus variant in India. If you go, we will go for it by the evidence. Recently, NIV Pune, that is ICMR Institute, has come up with a publication, and that clearly says like Delta variant is also having the good efficacy. Means the current vaccines, Covishield and Covaxin, have both are having the good efficacy against the current strain. So as far as we can say now, there is no problem, like no concern regarding the vaccine efficacy regarding the current strain and current vaccine which we are having. So for now, it is important to take vaccines, do motivate others, and use appropriate behavior. So because mechanism is the different, which is well, the public is not concerned about the mechanism. Mechanism we are discussing here, but for now concern is that the all vaccine which are available in market and all variants which are available in the circulation, the all vaccines are effective against the viruses, those who are here. So it is important to get vaccines and motivate others. Yes.
Right. Dr. Arora, there have been a lot of talks about the anticipated third wave. A lot of information also is available in the public domain. Vociferously advocated the fact that possible to avert, but only if we put our act together, like we have been discussing. How do you see this?
So, in fact, whatever during last 1.5 years we have been able to achieve has been because there has been a whole of society and whole of governance approach. Multiple departments, multiple stakeholders within the departments, multiple disciplines have come together. Otherwise, this was not possible. Oxygen deficiency was not managed by health sector. The industry and the railways, the transport ministry, all of them came together. So I think last 1.5 years should also be taken as an opportunity to learn that how things can perform better even in these constrained times if all of us come together. So I think a key message we have learned during last 1.5 years is that health is not something we can keep it on a pedestal. Health is very much part of our life. And when everybody comes together, then only health system can improve, health and wellness of an individual improve. Simultaneously, I think one very important message, we always knew it, but here it was, we saw it on the ground, that development and health are two sides of the coin. If health is affected, the GDP kind of drops down. And if GDP drops, then the health is also adversely affected. So I think these are some of the key, I would say, these are the benefits of pandemic we have seen during last 1.5 years.
Looking at the half glass full. But again, Dr. Rawat, more vaccine companies are coming in. Moderna, Pfizer, Johnson & Johnson, Zydus also for the adolescents. It will be a big push for the successful vaccination drive. And like I was asking Dr. Arora also, well poised now to prevent the anticipated third wave that we call it?
I think absolutely right. I think as Dr. Arora has said, and I would also like to put it on record regarding all the work which has been done in last 1.5 years. Like when Corona started, we didn't have mask, PPE kit, ventilator, oxygen generation plant, diagnostic kits. And now we got 2 indigenous vaccine which is being produced and conceived in India. It is really good. And when we talk about the vaccine, the Covishield will start producing about 10 crore doses a month. Covaxin will be nearly about 8 crore. Then we got biological E, which is going to be recommended in next few months' time. And then we got other vaccines like Sputnik is there, which has been approved. the Zycov-D, which is a first DNA vaccine which has been approved. Johnson and Johnson single dose has been approved. So things are brighter, and as long as we stick to the plan that everybody eligible gets vaccinated by year end, I think we will be winning.
Okay, so this is very, very important. This looks like a realistic target. By year end, we all will be vaccinated. But again, Dr. Arora, 50% of the eligible population has received the first dose, and over 15% have received both the doses of the eligible population. Are we going at a fast speed? By December end, are we vaccinating everyone? Realistic target.
We should not look at the rate that we have been doing it. The system has a capacity. Yesterday, it has shown the capacity that what we can deliver. The major constraint has been the supply of vaccines, the access. And as the supply is improving, we are able to deliver it with as much speed required to consume. In coming months, the estimate is that we should have 1 to 1.2 billion doses available with us, so that we can immunize most of our adult population. The Bharat Biotech production is likely to ramp up significantly from September onwards. Serum Institute is the other one which will also increase, and these are our two major suppliers. Zycov-D is coming on board with about 1 crore of doses every month, next month onwards. We are going to have 3 to 4 crore doses per month locally manufactured. Then Genova, which is the Indian DNA vaccine, RNA vaccine, they have committed about 4 to 6 crore doses within this year. They are in phase 3. And Biological E, as Dr. Rawat said, there has been an advance payment for them to 30 crore doses. They are making the vaccine, the trial has to finish, and then vaccine. So I think we should be able to meet all our requirements by the end of the month, but it is not the just availability. I think we have total capacity to deliver whatever is available to the health system. As far as the issues of vaccine efficacy, I must tell you, during last 3-4 months after Delta variant, a so-called Delta Plus came up, which has like 12 additional lineages or 12 additional children of that particular Delta virus. But none of them is threatening, more infectious or more virulent, or affects significantly on any of the vaccine efficacy. But vaccine efficacy, one brighter point is whatever vaccine is there, once you take the vaccine, severe disease fatality effectiveness remains pretty same. Antibody responses may be poor, antibody responses may come down, but the crux is that severe disease and fatality is not much affected, even when new variants have come during the last 6 months or 8 months. So overall, I would say we need to be forward looking, not whatever has happened. We have done whatever was available, it was delivered. We are going to deliver whatever as the things become more and more available.
Dr. Sumit Agrawal, if we look back at the process and how the government has worked on the logistics point of view, through CoWIN app, through Arogya Setu app, like Dr. Arora also said, it was more of a demand and supply thing. Abundance of supply now, demand is also there. People are going for the vaccination also in big numbers in urban areas and also in rural areas. But emergency approval of the vaccines, do you think has played a very, very big role and significant role?
Yes, definitely. Logistic, if we see, like, I will take you a little back more. Like when the first case was detected in India, we were having capacity of just one lab, which was able to diagnose the COVID. Then in current day, we are having 3,000 labs, which are able to diagnose COVID-19 19. Then we are having now rapid antigen test, rapid antigenic kits, and also the time for RT-PCR has been reduced to 6 hours. This all is possible. This diagnostic mechanism has been taken care by these things. Now, as Dr. Rawat said, now when we started with the first wave and the second wave, we were having less numbers of masks, equipments, ventilators, and oxygen concentrators and oxygen supplies. Now that has been also been taken care of by the government and the other associations. Like this, these are the two important. Now, if we are coming to prevention part, definitely we come up with the first vaccine in January 2020, and till then we were having a very few doses in initial month. If you see the average, it was around 10 to 15 lakhs per month. But now if you see the last month average was 43 lakhs per day. And now for this month, it's August, it's going on, and it's 53 lakhs per doses, 53 lakhs doses per day. So all these things show we are increasing with our logistic. And as Dr. Arora said, we are already using a universal immunization program logistic supply chain, which is there in place since 40, 50 years. So there is all things are in place. We have our logistic supplies, we have our trained healthcare workers, we have now vaccine supplies. So what we need, just people should come forward and they should take the vaccine.
Dr. Rawat, you think the pace of the vaccination in the country, you think it picked up following a policy reversal in June when the center started providing free vaccines? Because this will always be there in people's mind. Now also, if you have a paid vaccine or a free vaccine, people will go for the free vaccine. Free vaccine for all above the age of 18 and took back control of the vaccination from states. You think this was also very significant after the month of June? That's why it picked up pace?
I think it picked up pace because when government started giving emergency approval, and also government has been very proactive. Previously, there was a doubt that, whether central government is going to procure or the state government is going to procure. When you got a multiple sources for procurement, there is always a problem. And they were talking about different prices for different states. So what has happened, there is now one source of procurement, which is a central government. So, and what government has also done, they have become very proactive. As Dr. Arora has said that for biological E, government has already paid money for 30 crore doses. So that shows that they are very, very proactive. And that is how the things have changed, that we had 1 crore and 3 lakh vaccine in a day and 4.5 crore vaccine in last 1 week. So that, that makes us feel that we are winning, and we will have a vaccination for eligible people by end of the year. And what
Okay, Dr. Arora, there's some internet connectivity issue there with Dr. Rawat. We'll come back to Dr. Rawat again. But Dr. Arora, you think walk-in registration, it was also opened up to step up the pace of the vaccination? You think the policy reversal also, like I was asking Dr. Rawat, these factors have made a big difference after the month of June? That's why it has picked up pace?
So, I think for the first time we are using an IT platform, and so this platform is registering every beneficiary or every user who is getting a dose. And that is why if you look at COVID dashboard, every hourly we know how many vaccines doses have been given. Now that's a great achievement. We have learned during last 7 months the small glitches which came. The walk-in issue is something which was desirable as we learned how to manage it, because walk-in doesn't mean that it is as simple that you just walk in and get the vaccine. That is from a beneficiary perspective that was followed. But the important thing is that when you walk in, there is a space into the national database, And so that arrangement had to be made so that you could do that. And the other thing which has happened over the time is initially East Vaccination Center was expected that they will be able to provide about 100 doses per day. But yesterday we have seen it's about 160 doses per site at an average. So this is an ongoing learning process, and the important point to be appreciated that the system has been open to suggestions, has been open to mid-course corrections, and so be it the vaccination system. There is another thing which has happened. I'm sure all of us are aware that near home corona vaccination centers have been created. For example, big housing societies in a mega city so that elderly can come and those who have difficulty, they can walk and cannot walk around right next to their doorstep. But in villages, clusters of villages have been created where full space for 30 minutes, the vehicle, and so that the fragile and elderly above 60 can come to this. So this is an ongoing learning process. A lot of improvised innovations have been brought into the delivery system.
Right, we'll have to wrap our discussion in the next 1 or 2 minutes. Very quickly, if I can take a reaction of Dr. Agarwal and Dr. Arora also, and I don't know if we still have Dr. Rawat with us. Dr. Agarwal, everyone is asking this question, and everyone has this question. In fact, when will India be coronavirus free, and when can we move around freely? Very difficult to answer this question,
yes,
but again, what do you want to tell our viewers?
I would like to say, like, there will be no day when we'll be COVID free. Like, we have to learn our life in a new way when COVID will become endemic, and it will be always low rate in country. And also we will be vaccinated and we will have some better therapy. But for that, we need to we cannot lower down our guards. We have to use mass social distancing as we are doing.
Dr. Arora, over 17 lakh tests are being conducted on daily basis. We achieved the milestone of over 1 crore vaccine doses in a single day. Over 62 crore cumulatively, 50% of the eligible population, they have been vaccinated with at least first dose. I want you to answer this question. When do we see it going to the endemic stage?
See, there are 2 or 3 words which are more semantics. I think that have to be understood conceptual level. One is so-called herd immunity. It is a mystical and mythical word. What does it mean? And people have been proven wrong time and again, whether it is Israel or USA or Venezuela, there are all those examples. Similarly, so-called endemicity. Endemicity means that is a low level of transmission keeps on occurring. Not everybody is susceptible. And that is the ultimate fate of an infection or a virus like COVID, SARS-CoV-2. So both these things have to be understood in the context that we have to see that the whole population is exposed to vaccination, and if not, then natural virus, so that overall there is some degree of immunization or protection is there. On top of that, there will be these variants coming up. Sometimes there may be up. So it is very to be like influenza virus. And once we are through in next 2 or 3 years, I think the things will settle down and we can have a normal life. This virus cannot be eliminated. The thing is, there are several hosts. Unlike polio, unlike measles, where human is the only host. So the elimination, no, I think not even to talk about it. But control is something which is very much in our hand. And as we have learned, technology is to some extent the
got your point, Dr. Arora. Dr. Rawat, just final reaction from you very quickly, 30 seconds. when do we see India moving freely without the mask?
I think as I said that we will have to wait at least for a year more, and then we can't get rid of the virus as long as it doesn't hurt us. That is what it is, as has been explained by other two colleagues.
Yeah.
That we need to live together, and as long as virus doesn't hurt us, and it's the five-fold strategy:
Yeah.
test, track, treat, follow protocol, and vaccinate.
Yeah.
That is
very,
what we
very
need.
important. Absolutely, don't risk people's health and get vaccinated. Cases might be declining, but we have been saying this again and again. Doctors have been saying this. Our panel, it has been saying this. Do not risk people's health and go and get yourself vaccinated if you're eligible for it, and wear a face mask, maintain COVID appropriate behavior, which is very, very important. Thank you so much, Dr. Rawat, Dr. Agarwal and Dr. Arora. Thank you for giving us your precious time. Well, that's all we have in this edition of In Focus. Stay tuned for more news and updates. Namaskar.